Hi, Katie. How are you doing?
Hi, Louis. Thanks a lot for having me.
Thanks a lot for taking the time to join us today and do this interview.
No problem.
To start with, for our users, it'd be helpful to hear a little bit more about you and how you came to be CEO of London Vaccination Clinic.
Sure. So my speciality is immunization and travel health. So I'm a specialist nurse in that area. And I came into this career really through aid work. I was an aid worker for Médecins Sans Frontières. And I took part in a large vaccination campaign for measles in the Congo in Africa. And it sort of really set the fire for me for my interest in vaccines. So I set up a travel clinic on my return to the UK, and that's what I've been doing for the last decade. But I would say that I'm a strong vaccine advocate, and I'm quite involved in assisting healthcare professionals, but also families and individuals in vaccine hesitancy and supporting them in making positive choices about the vaccines that they choose to have for their families. So that's really my my passion at the moment. And obviously, I run London Vaccination Clinic. We have clinics across London where we provide travel health, but also immunizations.
Mhm.
And I hire nurses, and we have a large team now.
That's amazing. And obviously, that's how we originally connected over the need to address vaccine hesitancy and the benefit of VacTracks to patients in the UK and across the world.
Mm.
So obviously we mentioned London Vaccination Clinic there, which is a private clinic that obviously provides travel immunizations. Could you tell me how you would say London Vaccination Clinic differentiates itself from other clinics, other private clinics in the UK?
Yes, well, the model that we brought to the market in 2010 was surprisingly simple, and it was just enabling online booking. And
Right.
it wasn't really available until then. People had to call the other travel clinics. So we automated the system, so it made it very easy for people, and that did change the face of the sort of private travel health industry in London.
Mhm.
Now, I would say that what makes my company special is that we are predominantly we're nurse led, so it's very grassroots. We use expert nurses in travel health or immunization. We have a team of pediatric nurses, so they're particularly experienced in dealing with childhood IMS. And although we're a large business, we're quite a small team, and it's very much I'm very involved in the business on a day-to-day level, so it's very personal for our clients. So if you need at any time to speak to the CEO, which you can, I'm available to
Yeah.
people. So we've got that really. I would like to say that we're very in touch with our clients, and we're really committed to building a very positive culture within our company as well. With it being nurse led, it's very hands on. That sense of a duty of care to our patients.
Amazing. Obviously, culture is so important to the success of a company.
Yeah.
So you started in 2010. How many clinics do you have now?
So I set up another company in 2010,
Right.
which was London based. And I've been running London Vaccination Clinic since 2013. So we had 7 clinics across London. We're currently open in 3 because of the pandemic.
Of
So
course.
we've reduced obviously our workforce and our capacity to reflect the changing demands in this industry right now. And so we've got the 3 clinics across central London that we're working from at the moment.
Amazing. And when are you hoping to open the rest up again?
Well, I think next year we'll be able to look at expanding back into the other areas, because travel will kick off again. At the moment, obviously travel stopped altogether in March. It's
Yep.
stopped again just now in November. So I imagine that once we get into a position where we can control the virus more efficiently and for a longer period of time, everyone will want to travel again. So that's probably I'd say the first quarter of next year, but it will depend obviously on the vaccine and how that is provided for people.
Of course, and we're all eagerly anticipating the official data from that.
Yeah.
Um, and just obviously, VacTrack started at the beginning of the pandemic. So starting a company during that time has proven its own challenges, but also been very exciting. How did you deal with the pandemic, and how has that changed the way you manage and run your clinics?
Well, yeah, it was quite extraordinary because I sensed it was coming. Obviously, we heard about the situation in Wuhan in China, and
Yeah.
I realized, having a background in that in this sort of area, I thought this is likely to spread and it's likely to affect travel.
Mhm.
So I was anticipating that we would see a major impact on our business, but I wasn't anticipating that we would go into a lockdown situation. We've had to change the whole model of our business.
Mhm.
Um, we we initially had sort of 20, a team of 20 or 30. We've now got a third of that. Um,
Right.
but luckily, we hire nurses, and nurses were in great demand for other work, obviously, around that time. So a lot of our nurses went straight back to A&E and to
Okay.
hospital. But yeah, we've changed the model. I suppose the most positive thing is that we've really been able to speak to our patients and our clients. So it's much more. I spent the first 2 months, March and April, just talking to people all the time about COVID, about what it means, about how we could help them. We started to do the antibody testing for people and the swab testing, and we were
Yeah.
actually the second company to roll that out in London, to provide that. And we were providing it for the NHS as well, the client, the staff, because because they weren't able to get it through the hospitals and through the government at the time. So I love the way we're working now, because we're sort of smaller, and I can really speak to our clients, and we've really benefited from that. You know, there's a much more, feels much more face to face.
Yeah, that's amazing.
Mm,
And that leads quite nicely on to obviously VacTrack and what we're doing, working with the user through the app.
mm.
You mentioned that your company were innovators at the beginning in 2010 when you introduced the booking. So tell us about why you did partner with VacTrack.
Well, so having been in the industry, yeah, for over 10 years, people still, none of us really understand why this is not your vaccine history is not something that's accessible or shared. Having worked in the NHS, vaccine history is managed through their systems of recording data. But if it's old vaccine history from your original paper notes, it's not often not put in the system. So
Mhm.
even within the NHS, it's not necessarily accessible as accessible as you'd like it to be. There's no connection with the NHS and private companies, so you can't share the information. And it's actually been a major issue for the last decade. I mean, beyond, but since I've been doing this,
Yeah.
something that I've always been aware that is a problem for people. You know, people are losing their little paper booklets, if they even have them. There's no central source. So when VacTrack and I first spoke, it was very much, finally, brilliant. Yes, thank God we've got this, because the amount of times I've been asked, well, do you know my vaccine history? And having to explain that it's extraordinary. In 2020, we don't have a way to share this information. But so it's an absolutely necessary component to our work, and really useful for the client, the traveler, to have that history. Not only because it's going to save them money in the long run, because obviously you can have vaccines again and again. You can't
Yeah.
sort of overdose on vaccination because of the immune system.
Mhm.
Um, but it costs you money, and it costs you time, and it's kind of annoying if you've got to go through this process again. So it's a really useful tool for in fact anyone, not just travelers, but for families, for parents. for individuals who want to keep up to date with what they've been having, and also if they need, they need to know when their boosters are. This was another constant challenge for us, is informing people when they need their next dose, and that's something that VacTrack can assist people with. So that's really, it's really important.
Exactly, and that's how obviously VacTrack came about. It was the need of my co-founder Gabriella Hakim, who had no idea what her vaccination history was, and she needs to get vaccinations for travel.
Yeah.
So that's obviously where the idea came from, and then we've expanded from there. And the whole access and adherence is something that is core to our mission. So the adherence and following up on vaccination boosters, whether they're 6 weeks or 6 months apart, is something that's a challenge for patients, because there's no system that enables the patient to then have an automated reminder of when to be booked in.
Yeah.
So that's obviously what our plan is for patients. And what about the benefits to actual London Vaccination Clinic outside of the benefit to its users? How are you hoping to gain from your partnership with VacTrack?
Well, the first thing I'll tell you is that a lot of our clients, they come in for an appointment, and we talk about their vaccine history, and they're not sure what their vaccine history is. And so they want to call them, usually it's their mum, to be honest, because mums, we tend to keep people's vaccine history.
Yeah.
So, they want to call their mum, or they want to call their GP, or they end up not knowing, and they've got to spend more money ultimately on buying vaccines they may not need. So for us, that component of not needing people to call their mums or the GPs is going to be very helpful, because that takes time.
Exactly.
And also, what's great about VacTrack is that we can offer it to our clients. We get asked a lot for our clients' vaccine history, and so that takes time. Also, we have to provide that, and so for our clients to always be aware of what their history is. Also, in terms of, as we were speaking, them getting their boosters and coming in at the right time for their scheduled vaccines is also really important. So it'll assist us from an administrative point of view. I also support personally people taking sort of autonomy over their vaccine history, because it's not something, it is a naturally individually autonomous process, in that no one's sort of holding your hand through it. And as the NHS gets more and more busy and at capacity, this is really an area that we need to take responsibility ourselves for. So I really support it from that perspective as well. The great thing about VacTrack is that it also allows the user to have information about vaccines, information about the companies that you're partnering with. So for instance, we can put information on VacTrack about what we're offering, about certain statistics around vaccination. It's a way of also supporting people if they're feeling a bit hesitant about vaccinations. You can provide information. It's actually really difficult to get accurate scientific information. It's hard to get information from medical professionals on this subject. I very much lean into this subject on social media, but it's not without its stresses, because obviously the anti-vax component is quite intimidating. And although the social media are doing work around it, it's really difficult to understand, if you're coming from a sort of non-medical perspective, to know what's real and what isn't. So that is a really important aspect of the work with VacTrack, actually.
Exactly, and that's kind of where we position ourselves in terms of educating the general population, making sure they're aware of exactly what they have to have outside of travel as well, just in terms of the government recommended vaccinations, and making sure they're fully up to date with these, because without the records, without the reminding system, it is difficult to make sure that you stay up to date with the official information, especially right now with COVID. And then when the COVID vaccines rolled out, obviously that'll be staged. So people need a way to get direct confirmation of when they should be taking this vaccine, or when they're able to take this vaccine. So on that note of COVID-19, at the moment, we've obviously got a few vaccine candidates, which is very exciting. and the government are currently devising a strategy for rollout. How do you think private clinics can be involved in this and help the distribution of the COVID-19 vaccine?
Well, I think that it's going to be enormously challenging for the UK logistically. I mean, they've already purchased something like 100 million vaccines, I believe, and that's just from one supplier. How we do, so every year we do this with flu, right? So the NHS and the private industries provide flu, and the NHS are really very good at providing flu now. They have systems in place where they do flu clinics and it works very well. The difficulty is that we are still trying to protect the community from the virus, COVID. So getting people in and out quickly is difficult. There's some consideration around that people may need to wait for a certain period of time once they've had the vaccine to ensure that they feel well and they can leave the environment once they've had it. So there's some question about whether that's going to be necessary. What the private travel clinics have is expert nurses. So they have expert immunizers, basically. And that is a really useful resource, because we can use other people to immunize. You can teach people to give vaccinations, but they're going to need that sort of authority, that expertise. And I think that's where the nurses who are employed in travel clinics, where this all we do is immunize, frankly, they'll be very, very useful. In terms of the logistics, the vaccines have quite complicated logistics. Some of them are coming from a frozen, a freezer, and then you keep them in the fridge for a certain period of time, but they come in large batches. So there's going to be challenges around the logistics. But I think, and in fact, I do want to write to the local CCGs about this in public health, that we can assist in this provision. How it's going to work logistically will be challenging, and it will be dependent on how the travel health companies and clinics operate. But it's definitely neat. I think they should definitely utilize that. Any pharmacies as well have expertise in immunization. So anyone who can assist, and the Ministry of Defence, obviously, they have a lot of individuals who are taught to immunize.
Exactly. And I think VacTrack are totally in agreement with that. The logistics surrounding the distribution are going to be insanely challenging, and they need to draw on all of the support they can and the available resources. So we're behind London Vaccination Clinic when it comes to that.
Yeah.
The expertise of your nurses and nurses in general who work in these travel clinics. You have your own training program for nurses, is that correct?
Yes, I have a training company, and I used to work for them for years teaching, and then they sold it to me, and it's called Riva Training Limited, and I teach immunology, immunization theory and practice to nurses, healthcare support workers, the Ministry of Defence, medics, school nurses, occupational health nurses. So anyone who's in, who part of their work involves injecting vaccines, or in fact any injectable into their patients, and they need training. And the national minimum standards require that everybody has a sort of 2-day intense training to become an immunizer. And then you have to have an annual update to ensure you maintain your knowledge. And so that's primarily what I do. Amazing.
And we've obviously spoken about this in depth before, but VacTrack, we want to work with nurses to make their lives easier, as you mentioned previously, to make sure that patients aren't turning up not knowing. So how do you think the VacTrack and this reaching out to nurses and working with nurses can happen in this setting?
Well, there's quite a discrepancy between the different professions of nurses over this subject in terms of immunization, in terms of what they know and what they're taught. There's not a lot of provision for doctors and GPs in terms of immunization theory and practice. They do it at university, but after that, unless it's their specialty, and in general practice, it's not really, they can get left behind, and they're not doing regular updates. For practice nurses who work in the GP surgery, who do all the childhood IMS and the adult IMS on the national schedule, they have other very important roles, you know, in chronic disease and other things, that it's very difficult sometimes to be an expert in everything. And so we need to find a way to formalize and standardize education around immunization across all the professions, because of this major discrepancy. The problem as well with this subject is that if you're not updated regularly, you can, and because of the amount of false information on social media, you can become vulnerable, even as a health professional, to the negative press around vaccination. And a lot of the work I do with healthcare professionals is just asking them to look at their core beliefs around vaccination and whether they have been influenced by the negative social media. So there's a lot of work that VacTrack can do to sort of standardize that. There's a lot of training out there. Some of it is online, some of it is face-to-face, and it is of high quality, actually. But it's really what I found is, particularly nurses, the basics are sometimes not there. So the notion that, you know, your immune system remembers, so you don't have to restart a course of vaccines. You have 20 years between the second and the third dose. And although that's not ideal, because you're protected, your body will remember. You don't have to redo vaccines. And a lot of nurses who have been in practice for a long time don't even realize or recognize that. So there's a lot of potential through VacTrack, that although it's very much there for the user who's having vaccines, it's also really helpful for healthcare professionals. And remember that healthcare professionals also have vaccines for travel. So it's there's a huge potential with that in terms of educating people on a large scale.
Yeah, exactly. I totally agree. I think there needs to be standardization across the industry in terms of knowing what has to be taken when. And with the app, it does that for you. It takes all of your history into account and then does the recommendations based on that. So if you're outside of that ideal range, it's still recommending that you take the booster rather than start the course again. So it incorporates all of that. Great. And then lastly, just to wrap up, there's a lot in the media right now about vaccine mandates. So either for entering countries or even for going on specific airlines, entering specific venues like pubs was recently in the news. What do you think about vaccine mandates? And do you think it's going to be necessary in order to help end this pandemic?
So personally, there's been a lot of research done into this. And I did interview a woman from Australia who has a PhD in research vaccine stuff, and she has been reviewing how mandatory vaccination works across globally. So she's been comparing countries, and what's interesting is that mandatory vaccination works for those people who are already okay about vaccines but are just maybe have just forgotten, or they're a bit organized. So it works to kind of scoop up the people who were always going to do it, but they didn't get around to it. However, mandatory vaccination entirely polarizes the group of individuals who really don't want to have the vaccine, or are nervous or unsure. So we have most people are in some way vaccine hesitant, whether that's just asking one question or 20. We all want to know what we're taking in terms of medication or vaccination. So the vaccine hesitant group are significant. Mandatory vaccination can, I think, cause damage, and it does give a platform for the very extreme anti-vax group. So I would always recommend caution with mandatory vaccination. There's mandatory vaccination in the USA, and it causes lots of issues. And ultimately, those people who truly believe they don't want to have a vaccine will work around it anyway.
Yeah.
However, you know, COVID is a major issue. It's a global pandemic, and we do need to stop the movement of this disease.
Mhm.
And it may be that some airlines and other organizations do insist on having the vaccine. Now, there is this is not a new thing. There's mandatory vaccination around yellow fever. Yellow fever is a global public health issue, and it's present in certain countries that have the correct monkeys and mosquitoes for the disease to move, and those countries insist that people are vaccinated to protect the spread of that disease. Equally, Ebola, there was talk about mandatory vaccination around that to stop the movement of individuals from country to country across borders. So that is mandatory vaccination. It works very well. No one has a serious issue with it. So given that it's a choice to go traveling or to do social events, mandatory vaccination could work in this context. When they start putting mandatory vaccination, you know, into schools, so you can't send your children to school without it, it starts to get controversial.
Of course, and I think the play from the government has to be so careful and cautious moving forward with that.
Yeah.
Vaccine hesitancy has always been a thing, but I think now with the COVID vaccine coming around in 9 months in comparison to 20 years, has increased the concern in the general public. So strategy moving forward to getting as much of the population vaccinated as possible definitely has to be well thought through and very cautious in relation to this vaccine mandate. But so yeah, total agreement with that.
Yeah, I mean, the vaccine that we have for COVID, the ones that are available are very effective. I think a lot of people don't realize how effective vaccines are. We have vaccines that aren't that effective, and we use them all the time, and they create, you know, herd immunity, and they protect those that they need to protect. But the COVID vaccine, if the end result is that it's 90 to 95% effective, that's just extraordinary. It's very positive.
Exactly. The results that we've seen so far are very, very promising. And I think they're supposed to be getting FDA approval within the next week or so. So we'll be able to see if those results live up to that.
Yeah.
A very exciting time for the vaccine industry for sure. Well, that brings me to the end of my questions. So thank you so much, Katy. That was really interesting and insightful. VacTrack are obviously incredibly happy to have London Vaccination Clinic on board, and we're looking forward to continue to develop the partnership.
Yeah.
If there's anything else you'd like to add to wrap up, that's fine.
Well, thank you very much. It's been very interesting, and I've been involved with this partnership for some time, and I'm very impressed with the app. I've downloaded it myself, and I think it will be incredibly useful, and I think it will grow the potential for the app to really support not only individuals in the UK, but also from a global perspective. You know, maintaining your vaccine history is challenging in every context, and supporting vaccination and supporting individuals who don't necessarily have access to vaccination is really essential work. It's so important. And I'll just end with a snappy fact. The World Health Organization say that 2 to 3 million lives are saved from vaccination, and that if we had more access and availability, another 1.5 million lives could be saved. And that's most of those lives are in the under fives, little ones. Yeah. So it's such important work. So I'm very proud to be part of it with you. Thank you.
Thank you very much, Katy. Enjoy the rest of your day.
Thank you.
So amazing. Okay.